Well, expanding the story that came in from Karnataka, where a digital war of words have now broken out over the Jan Aushadhi scheme, a flagship initiative to mark and make affordable medicines accessible to all. At the center of this clash is the Health Minister of State, Dinesh Gundu Rao, and RN Capital Chairman Mohandas Pai. Now, the controversy was sparked by a tweet from MP Tejasvi Surya, has alleged that Karnataka government under the Health Minister Dinesh Gundu Rao has ordered the closure of multiple Jan Aushadhi kendras across the state. He has claimed that nearly 200 centers in PHCs, CHCs, Taluk and Zilla hospitals are being forced to shut their doors. He has urged now the Health Minister to reconsider and reverse the decision. Meanwhile, when we speak of Mohandas Pai, who has joined the chorus by retweeting the post and has launched a pointed attack at the State Health Minister Dinesh Gundu Rao. He's questioned the rationale behind the alleged closures and has accused the minister of turning his back on the poor. Let's put that out exactly what has now been said in this virtual war of words that has been taking place, because hitting back at Mohandas Pai, Health Minister of the state Gundu Rao has now asserted that the ministry doesn't need lectures from outsiders, reaffirming the government's commitment on providing free treatment to the poor. He also took a swipe at Mohandas Pai, accusing him of being quick on the trigger whenever it comes to the Congress party. Now, this is exactly when it comes to the war of words that have been taking place on social media. Let's put that out in context, because the Jan Aushadhi is one of those core guarantees. And what is being said, that guarantee number one, which provides generic medicines priced at 50 to 90% lower than the branded counterpart. So it helps, especially when it comes to the people who come from poorer backgrounds. Another guarantee which talks about that all of those medicines are actually tested for quality and for safety features as well. Another guarantee that it talks about, that there is focus on rural and semi-urban areas to expand access when it comes to medicines. And of course, another guarantee that it covers the treatment for chronic conditions like cancer and heart diseases as well. So it becomes highly accessible. Another guarantee which it says that it provides opportunities also to open Jan Aushadhi kendras with incentives that come in from the government side. Let's in the meantime get in a word from Neha, who's connected with us right now. Neha, good morning. Now, over the suspension of the Jan Aushadhi kendras inside government hospitals, responding to Dinesh Gundu Rao's remark defending the move, Mohandas Pai is of the opinion that if the government hospital run out of stock, what will the patients then do?
Well, that's absolutely right, Amita. Of course, we're seeing a massive war of words now that's erupted over here. What began, of course, with BJP MP Tejasvi Surya's tweet there, raising questions and concerns about the closure of these Jan Aushadhi kendras, has today, in fact, turned into a massive, full-blown war of words there. Here you have, of course, Mohandas Pai, a prominent citizen of Bengaluru, raising a question now about what happens if the stock of medicines at the government hospitals get over. And, of course, in retort, you have the health minister there, asking him to, of course, not really worry, because the government, of course, is handling the situation. At the end of the day, it really remains to be seen right now. Again, another instance of where we're seeing, it happens to be the state versus the center. Yet again, that's politics that's being played here. And citizens, of course, unfortunately, are going to be at the receiving end of this.
Right, but Neha, when it comes to the counter argument that is now coming in from the minister's side, saying that the Jan Aushadhi provides medicines at subsidized prices, but the Karnataka government provides free medicine. So what is the need for Jan Aushadhi within the government hospital premises, is the counter that has now been put across by the state minister. For the moment, thank you very much, Neha. We'll come back to you.